Understanding vaginal yeast infections. Before delving into treatment options, let's briefly understand what a vaginal yeast infection is. A vaginal yeast infection, also known as candidiasis, is a common condition caused by an overgrowth of a fungus called Candida. This fungus is naturally present in the vagina, but when it grows excessively, it can lead to symptoms like itching, burning, redness, and a thick, white discharge, causes of vaginal yeast infections. Several factors can contribute to the overgrowth of Candida, including antibiotic use. Antibiotics can kill beneficial bacteria in the vagina, allowing Candida to thrive. Pregnancy. Hormonal changes during pregnancy can create a more acidic environment in the vagina, favoring the growth of Candida. Uncontrolled diabetes. High blood sugar levels can increase the risk of yeast infections. Weakened immune system. Conditions like HIV, AIDS, or treatments like chemotherapy can suppress the immune system, making it harder to fight off infections. Use of corticosteroids. These medications can suppress the immune system and increase the risk of yeast infections. Symptoms of vaginal yeast infections. Common symptoms of a vaginal yeast infection include itching, intense itching in the vaginal and vulvar area. Burning, a burning sensation, especially during urination or sexual intercourse. Redness, redness and swelling of the vulva. Thick, white discharge, a thick, curd-like discharge that may be odorless or have a mild odor. Pain, pain during sexual intercourse. Diagnosis. If you're experiencing symptoms of a vaginal yeast infection, it's important to see a healthcare provider for a proper diagnosis. They may perform a pelvic exam and take a sample of the vaginal discharge to examine under a microscope. Treatment options. Several treatment options are available for vaginal yeast infections. Over-the-counter antifungal medications. These are typically the first line of treatment for mild to moderate yeast infections. They come in various forms such as creams, ointments, and suppositories. Common ingredients include Clotrimazole, available in both prescription and over-the-counter formulations. Miconazole, another popular over-the-counter option. Budoconazole, often used for shorter treatment courses. Prescription antifungal medications. For more severe or recurrent infections, your healthcare provider may prescribe a stronger antifungal medication such as fluconazole, an oral medication that is often taken as a single dose. Natural remedies. Some people find relief from vaginal yeast infections using natural remedies such as yogurt. Plain, unsweetened yogurt contains live cultures that can help restore the balance of bacteria in the vagina. Boric acid suppositories. These can be effective for recurrent infections, but they should be used under the guidance of a healthcare provider. Prevention. To prevent future yeast infections, consider the following tips. Wear cotton underwear. Cotton allows your skin to breathe and helps keep the vaginal area dry. Avoid tight-fitting clothing. Tight clothing can trap moisture and create a warm, moist environment that promotes the growth of Candida. Practice good hygiene. Cleanse the vaginal area daily with mild soap and water. Avoid douching. Douching can disrupt the natural balance of bacteria in the vagina. Control blood sugar levels. If you have diabetes, it's important to keep your blood sugar levels under control. When to see a doctor. Most vaginal yeast infections can be treated effectively at home. However, you should see a healthcare provider if over-the-counter treatments don't relieve your symptoms. You have frequent yeast infections. You have other symptoms such as fever, abdominal pain, or bleeding. You're pregnant. Thank you for staying with us until the end of this video. If you enjoy our videos, please give us a like, subscribe to the channel, and share your thoughts in the comments. Let us know what you'd like us to make videos about next.